start, remove any dangly jewelry and rings. I usually tie my ring to my drawstring so it's easy to keep track of. Next, you'll grab a chlorhexidine scrub brush and open it to find you have a scrub brush with a sponge and a brush side and then a nail pick. Get it all wet so you can create a nice lather. Then lather up your hands and forearms first so you can start to get your 5 minutes of chlorhexidine contact time started. We typically scrub up to just below the elbow on the forearm. Next, use your nail pick to remove any dirt and debris from under your nails and in your cuticles. The area under the nails has been found to harbor the most bacteria compared to the skin in the forearms. If you've got to wear nail polish, it should be freshly applied and free of chips. Nails with chipped nail polish on them or polish worn for more than 4 days have been shown to harbor a greater number of bacteria than unpolished nails. Artificial nails and overlays should never be worn in surgery. Cultures of surgical team members who wear artificial nails have demonstrated an increased number of bacterial and fungal counts compared to those that did not. Additionally, artificial nail wearers have been found to have a greater hand carriage of gram-negative organisms compared to non-wearers. Once finished, the nail pick is dropped into the sink. The brush side is used to scrub under the nails and nail beds. The harsh brush side should not be used on your skin, however, because this creates microtrauma and increases bacterial regrowth after scrub. The soft sponge side should be used on the skin of your hands and forearms. Remember, the water doesn't need to be on the whole time you're scrubbing. Once you're finished with your nails, the sponge side is used to loosen dirt, debris, and hair, and to distribute the antiseptic soap across your hands and forearms. The scrub starts with the areas used in surgery, which need to be the cleanest, your fingertips, fingers, and palms, and then move to the areas less directly involved in surgery, like the back of your hands, and lastly, your forearms. Each surface of the finger should be scrubbed, and this includes the space between your fingers. While you're working on your hands and fingers, your initial lather with chlorhexidine antiseptic soap is still in contact with your forearms. You don't want to drag your sponge from a dirtier area like your forearms back to the hands and fingers because you'll bring dirt, hair, and debris with it. So the hands should both be scrubbed adequately before moving on to scrubbing the forearms. Okay, so now I feel pretty good about my nails and all the surfaces of my fingers, palms, and the back of my hand, and they're just going to sit here and lather and get some more contact time as well. I'm ready to sponge my forearms. There's many ways to do this, but it's ideal not to drag the sponge back and forth from the elbow to the wrist. So I usually start at my wrist like this, then rotate my sponge around the wrist with quick little scrub motions, and then start back again in the same place, another sponge lengths down, and repeat. We do the same on our final forearm. Now we're done with the sponge, so we can drop it, and we can give our hands one last kind of rub down and lather. And then once we've had a total contact time of 5 minutes elapse,
5 minutes later,
you're ready to turn your water on and rinse. You want to keep your hands up. You really don't want your hands to be pointing downward because when you're washing, if you're pointing downwards, that dirty hair water is just going to run towards your clean palms. So you want to keep your elbows down. You kind of have to squat. It's a little awkward, but you want to keep your fingers up so that the water is running from the cleanest parts from your fingertips downward. And you get a good rinse there. And then you'll switch to the other side. And if at any point you accidentally touch sink or something non-sterile, you have to start your scrub over, unfortunately. You need to give yourself at least another minute of scrub. And once you're good and rinsed, you can see that water running off my elbows, and that demonstrates the point of why it's important not to bring your arms down, because it'll be running down towards your hands. So you keep your arms up the whole time as you walk to the OR, and then you dry off using a sterile towel.